Assalamualaikum and a very good day to everyone. We are Group the Enigma and today we will present our project on a digital mental health literacy hub for higher education students. So without further ado, let's begin.
Hi, my name is Mohammed Shirami. In this presentation, I'll be talking about the introduction part. So first in the introduction is the purpose of the document. It outlines the clear communications between the stakeholders and other entities, the user expectation and system needs, covering the whole process. And it also covers the SA's process, to be process, and also the most important part, the system goals and regions. And last but not least, it also have the requirements part. It captures the direct feedback from UTM community and reviewing the existing documentation and systems. So next is the scope. It explains the scope of the system. In this case, the Digital Mental Health Literacy Hub. It also will explain the core features, which is interactive learning modules. It is important to note that this hub is not a substitute for the emergency mental health services. And the most important part is the objectives of this document regarding the digital mental health literacy hub. It helps students to identify early mental health symptoms. It is also designed for a smooth integration with other external systems. The next is the definitions, acronyms, and abbreviations, which will be used to help the user requirement definition document. For instance, the UI, which is known as the user interface, and the UX, which is user experience. It also has these references, which is taken from outside source. For instance, the Department of Personal Data Protection, covering the PDPA Act, Personal Data Protection Act. The information are taken from this part. Last but not least is an overview of the user requirement definition document. Inside the document, it is split into 5 sections. The introduction part, which I'm explaining right now. The next is the proposed system vision, what is expected. And then we have this SAs for current process analysis, analyzing how the current process is done. And the most important part is the proposed to be processes. It outlines what needs to be done in future and how to improve. And last but not least, the appendices section, having external information such as extra diagrams, templates, as well as the in-depth references for implementing what's implemented in the document. Thank you.
Now, let's take a look at how the vision of our mental health support platform is broken down into specific goals. We have used an end decomposition approach. That means every sub-goal you see here is essential. All of them work together to achieve our main objective. Our main goal is to build a comprehensive digital platform that helps students take charge of their mental well-being, giving them the tools, support and guidance they need and when they need it. To achieve this, we have identified 10 key focus areas. First and foremost, students need to know where to start. That's why we will offer interactive literacy modules to provide engaging, reliable mental health education. But just having access is not enough. They also need to feel motivated to keep using the platform. To address that, we will integrate gamification elements like progress tracking, achievement badges, and rewards to make the experience feel more engaging and less clinical. Once students are engaged, we can help them become more self-aware of their mental health. With mood trackers and self-assessment tools, students can reflect on how they are feeling over time and spot early signs of concern. Now, since every student is different, the support they receive also needs to be tailored to them. Here we use AI to personalize the experience, recommending specific content, activities, or resources based on each student's profile and needs. And when they need more than just digital tools, real human help should be just a click away. That's why we will include features for booking and attending virtual counseling sessions, making sure help is always accessible even remotely. But support doesn't always have to come from professionals. Sometimes students just need a peer to talk to. We will create a safe, moderated peer community where students can share their experiences and offer encouragement to one another. While this student-to-student support is powerful, faculty also play a crucial role in student well-being. With the right tools, faculty and staff can spot warning signs early and offer guidance or referrals to professional services. And once a student is referred, professionals need a way to manage their care effectively. We will provide a centralized dashboard for mental health professionals to manage cases, monitor student progress, and offer timely, targeted interventions. Meanwhile, the broader institution also needs visibility into how the platform is working. Through analytics dashboards, administrators can monitor engagement levels, identify key trends, and make informed decisions about resource allocation. But even the best design system needs to evolve with its users. So, we will implement a feedback loop that gathers input from students, staff, and professionals, helping us to improve the platform over time and adapt to new needs. In short, each of these sub-goals connects to the others, forming a complete ecosystem of care. Together, they help us to build a holistic student-centered platform that not only informs but also supports, engages, and adapts, truly empowering students in their mental health journey.
Salam sejahtera everyone. Today I will presenting the as-is process analysis for student mental health support, where I will focus on the challenge and improvement opportunity we have identified in the current system. Mental health support for students is an essential component of their well-being, but the current system is fragmented, outdated, and lack proper digital integration. The objective of this analysis is to highlight this key issue and propose improvement that can benefit students, faculty, and mental health professionals. First, let's look at the issue of manual registration and limited access. Right now, students register for mental health support either in person or through email or phone, which can be time-consuming and inefficient. There are also limited availability of counselor, which add another barrier. Stakeholders involved here include student, counseling admin, and counselor. To improve this, I suggest implementing online registration and virtual support option. Additionally, introducing a 24/7 chatbot for assistance and real-time session booking system can make the process much more efficient. Next, the access to resource is inconsistent. Information is scattered across flyers, website, and brochure, and much of it is outdated. The stakeholders affected here are students and faculty. A centralized digital hub with mobile responsive content and AI-driven personalization will make information easily accessible and relevant for all students, improving the overall experience. Another challenge is the lack of engagement and motivation among students. Participation in mental health program is often low and there no gamification or interactive tool to encourage students to stay involved. Here, student and mental health professionals are the key stakeholders. Introducing gamification elements such as badge, point, and progress tracking, along with achievement reminder, can motivate students to engage more with mental health resource. Many students are unaware of their mental health status due to the absence of structured self-assessment tool. This lack of self-awareness can prevent early intervention. The stakeholders here include students and mental health professionals. To address this, mood tracking and self-assessment tools should be implemented to allow students to reflect on their mental health and identify potential issues early on. Another issue is the one-size-fits-all approach to content delivery. Many resources are either irrelevant or boring for some students, which reduce their impact. This concerns both students and administrators. We can solve this by introducing AI-driven personalization with tailored content and learning path to individual needs, ensuring students receive information that is useful to them. Currently, the appointment system is outdated, with students manually booking session or relying on walk-in. There are also no availability for after-hour or online session. The stakeholders here are faculty and administrators. A digital calendar integration with automated reminder and 24/7 access to appointment would make the system more flexible and user-friendly for everyone involved. There is also lack of formal peer support network. Many students feel isolated or hesitant to reach out for help due to the stigma and their shortage of trained peer advocates. The stakeholders here are students and peer supporters. Creating an anonymous peer support platform with trained responders would provide a safe space for students to seek help and support from their peers. Faculty members often lack training in identifying mental health risks and are not sure how to refer students for help. This gap can delay intervention and support. The stakeholders involved are faculty and content developers. By providing quick guide and training models on mental health awareness, along with secure reporting tools, we can equip faculty with the knowledge to take the necessary action. Mental health professionals currently work with disconnected tools, relying on paper record and manual data entry, which can lead to inefficiency and error. Stakeholder affected here are counselor and system administrator. A unified platform for case management, along with real-time synchronizing of student profile, would streamline communication and enhance the support process for both counselor and students. There also no centralized system for tracking student engagement or mental health trends. Data is collected manually, making it difficult to identify patterns or measure the effectiveness of current support system. This impacts administrator, IT, and legal advisor. Implementing an admin dashboard that track engagement and risk pattern would allow for more proactive intervention and data-driven decision. Currently, there is no structured way to collect student feedback, and the existing systems are disconnected, which make improvement difficult to implement. Stakeholders here include admin, IT, and legal teams. Integrating feedback forms, scoring system, and connecting them with existing portal and learning management system (LMS) will provide better insight into the system effectiveness.
My name is Hakim, and today I present the proposed to be a process for the Digital Mental Health Literacy Hub project. Okay, slide 2 overview the proposed to be processed. This section covers the future state process that will be replaced the existing one. As identified there as analysis, it focuses on student onboarding education module, AI support and engagement with the community professional. All features comply with data privacy standard SPDA/GDPR. In slide 3, student onboarding, a profile setup. Student will register using their official university email. They can choose their preferred language, mental health topic of interest, and accessibility need. All users must agree to platform privacy policy. Student data is encrypted and rule-based access is enforced. In slide 4 is about the access module and gamification progress monitoring. Student can be accessed self-paced learning module including videos, quiz, and simulation. Modules are structured into levels, basic, intermediate, and advanced. Rewards such as badge and point are given for progress. A personal dashboard allows the student to view the learning status. In slide 5, self-assessment, mood tracking, and AI support. This platform provides a validated self-assessment tool to help a student to understanding their mental status. Students can track their mood daily and view emotional patterns. AI recommended content and activities based on their interaction. The chatbot assists it identify high risk keyword to escalations. Then slide 6 about the visual support, peer engagement, and faculty tools. Visual support is available for students, a book, online counseling, including emergency access, peer forum, or moderated by the peer advocate. Faculty can be confidently report a risk student through a dedicated dashboard. In slide 7, admin analytics and system integration. Administrator can view analytics such as user engagement, risk trend, and mental health pattern. This system integrate with the student portal LMS platform to ensure that synchronized information and continuous feedback loop. That's all.